So you've moved to a new country for a fresh start. But little did you know that a few hidden traps in that country could be hurting you more than you realized. What if I told you that there are 5 things quietly working against you, slowly taking a toll on your health, both physical and mental? And the last one, it's something that you might be overlooking completely. So sit back and let's discuss. Welcome back to another episode of Immigrant Wellness Tips with Dr. Alma, where we're talking about health and wellness issues that matter most to the immigrants all around the world. Today, I'll be talking about the everyday challenges that could actually be killing you slowly but surely. And no, I'm not exaggerating. These are issues that build up over time, impacting your physical and mental health. And this do in ways that many people don't even realize. If you're an immigrant or you know somebody who is, trust me, you would want to listen all the way through, because at the end, I'll share actionable steps you can take to combat each of these silent killers. Number 1, silent stress of immigration. This might sound simple, but it cuts really deep. Stress. Now imagine this. You're navigating a new language, a different culture, maybe even facing financial strain. That's a heavy mental load. Studies show that chronic stress from adjusting to a new country can lead to serious health issues like high blood pressure, weakened immunity, and even depression. And here's the scary part. The body doesn't know the difference between constant immigration stress and a life-threatening emergency. It reacts the same way. So how can we overcome this? Number 1, take time to distress daily. Even 5 minutes of deep breathing can help. Number 2, build a support network of other immigrants or community groups. Having people who understand your struggles can ease the mental burden. Number 3, find small self-care routines like a walk, journaling, meditation. These can help to ground yourself. And speaking of routines, let's dive into something we do multiple times every day, and that's our diet. This brings me to the second thing that could be hurting you significantly as an immigrant. Poor dietary choices. Food is more than just fuel. It's a part of who we are. But when you move to a new place, suddenly your traditional foods might not be as accessible or affordable. You end up eating more fast food, processed foods, snacks, things that just don't nourish your body the same way. No wonder we see that immigrants often see a rise in diabetes, hypertension, and other diet-related health issues. And that's without even talking about the struggle of finding something spicy in a country that considers black pepper as spicy. So how can we overcome this? Number 1, seek out local ethnic markets. These may carry your traditional foods and you would never know until you actually go looking. Number 2, consider meal prepping with healthier ingredients. Even if it's not exactly like home cooking, it can cut really close. Number 3, if you're open to it, consider fusion recipes. These blend your culture with the local one, like adding some African spices to your local vegetables. I do that all the time, and the food always comes out delicious. So let's move on to how you're actually taking care of your body or not taking care of your body. Third reason why immigrants are suffering is limited access to healthcare. Now, here's one we've all felt at some point. This is struggling to navigate the healthcare system in a new country. It's complicated, it's intimidating, and even worse, if you don't have insurance or you're even afraid of discrimination. Imagine feeling sick and your child is feeling sick at home and you're needing a doctor, but delaying it because the system is just confusing. Or worse, you're being afraid to go because you don't want to be judged. It's a very real barrier for immigrants, and I hope we can overcome this. How can we actually overcome this? Number 1, research some immigrant-friendly clinics or community health centers near you. Many could have translators and services that actually gear towards newcomers and immigrants. Number 2, look into telemedicine options. These can often vary from phone calls to video calls, and it can be easier to navigate and sometimes much less intimidating. Number 3, find local resources or apps that simplify healthcare information or offer services specifically for immigrants. So in your locale, you might have some apps that has been developed by the government and they can help you to navigate the healthcare. And while healthcare might feel distant, The next issue I'm about to talk about, it actually hits much closer to home, and that is isolation and lack of support. Point number 4. Being an immigrant can be very lonely. Leaving your family, leaving your friends, and the familiar things you know behind. And these can feel like losing a part of yourself. Studies show that social isolation is linked to depression, anxiety, and a range of physical health issues. As you can see, it's a paradox. You're surrounded by people, but you feel more alone than ever. You're like a ship in the big city. And that loneliness, it's bad for your health. It's as bad as smoking 15 sticks of cigarettes a day. How can you overcome this? 1. Build new connections through local events, religious communities, or like immigrant networks. Even if it's virtual groups, it can be a big help. Build new connections. Number 2, try to stay in touch with your family back home. This could be through regular video calls, phone calls, texts, or chats. Number 3, don't be afraid to put yourself out there. Through volunteer work, clubs, or even neighborhood meetups, this can be a very great way to connect. Don't always say no and turn down every invitation. Last but definitely not least, let's look into something a lot of people ignore. Number 5 item that might be hurting you: ignoring preventive care. In many countries, healthcare is often reactive. So you get sick, then you go seek for help. So immigrants may not be used to preventive screening like mammograms, blood pressure checks, or mental health assessments. But here's the thing: skipping these can lead to serious conditions going unnoticed. So preventive health care might seem unnecessary if you're not used to it, but it's a powerful tool. And ignoring it could mean catching a condition too late. And this is one of the easiest changes that you can make. How can we overcome this? Take time to understand what preventive screenings are available and recommended for you based on the country and the city that you live in. Ask your healthcare providers about affordable options for screenings or programs that offer them for free. Consider making a checklist for your annual health screening, which I strongly recommend, and checking them off as you go. It's better to catch something early than to face a major issue much later. So there you have it. I've shared with you 5 hidden dangers that could be hurting you as an immigrant. But here's the good news. None of these are inevitable. You have the power to take control of your health, one small step at a time. And to wrap it up today, remember, manage your stress, be mindful of your diet, don't shy away from healthcare, build a social network, and don't skip preventive care. Simple actions like these can actually make a world of difference in your life. So if you found today's episode helpful, don't forget to share it with other immigrants who might be going through the same struggles. Let's help each other to take control of our health and thrive in this new chapter. Until we meet again next time, bye-bye.